While never our first choice, medications are sometimes a necessary part of caring for persons with dementia. Your understanding of these medications, their role, as well as their potential side effects, helps to ensure the best possible care for your residents. Throughout this video, we will discuss these important facets of medication management in dementia care. Your resident with dementia will take many of the same medications that your other residents take. But when we talk about medications used specifically in dementia care, they fall into two general categories. The first category are those medications that are used to treat the actual disease, the disease causing that person's dementia. The second category are medications that are used to manage the behavioral manifestations of dementia. We would like to see most medications come from the first category because these hold the most hope for improving the overall symptoms as well as the quality of life for that resident. However, it is sometimes necessary to use medications from the second group, those that are used to manage behavioral manifestations. Our concern is that these medications often come with many negative adverse effects or side effects. When we talk about medications that are used to treat the actual disease or cause of the person's dementia, this list is unfortunately very short. While research is always looking into new potential treatments, there are currently relatively few medications that treat the actual disease that is causing that person's dementia. Now, to really understand what that means, let's talk for just a moment about the diseases that can cause dementia. The word dementia itself is a fairly broad umbrella term. It refers to the person's symptoms, such as memory loss, language problems, reasoning difficulties, etc. There are many different diseases that can cause a person to develop dementia. Statistically, the most common cause is, of course, Alzheimer's disease. But other causes include vascular dementia, which is related to strokes, Lewy body disease, which is sometimes related to Parkinson's. Dementia can also be caused by infectious conditions. There's a type of dementia called frontal lobe dementia.
I think where we see the biggest problem is if you have somebody with Lewy body dementia and somebody gives them a psychotropic drug that's inappropriate, we get into real trouble. Or the person that has frontotemporal dementia again, that's very violent, using antipsychotic drugs or sedative hypnotics or tranquilizers just don't work. Whereas if you use a low-dose anticonvulsant, such as Depakote, these people are very easy to manage. So getting the right diagnosis and matching it up with the right medicine.
The point is, all of these different diseases are in one way or another destroying brain cells. And this progressive destruction of brain cells leads to the symptoms of dementia. So when we talk about medications that are treating the actual disease, what we're saying is that these medications are able to manage or treat the disease process that's happening in that person's brain. And again, there are relatively few of these medications currently available. Most of those that are available are targeting the most common cause of dementia, Alzheimer's. These medications work by altering enzyme activity or neurotransmitter activity in the person's brain to help restore normal brain function. What's important to stress is while these medications are encouraging and certainly a vast improvement over treatments in the past, they are in no way a cure for dementia. They help to treat or manage the causative disease, but they do not cure the person's symptoms permanently. Therefore, the role of these medications that are used to treat the disease should be seen as a way to help improve that person's cognitive functioning, potentially improving memory, reasoning, language, perception, etc. But as time goes by and the disease continues to progress, the person's symptoms of dementia will likely worsen. It's important that both we as caregivers, the resident, as well as the resident's family, go into this treatment understanding what effect those medications are likely to have. The good news is that the medications in this first group, while they can have some mild side effects such as nausea, upset stomach, diarrhea, vomiting, and the like, they have relatively few side effects compared to the medications in the second category. So again, to summarize, The medications that are used to treat the disease help to treat the underlying cause of that person's dementia, and by doing so can help to improve the person's cognitive functioning, but are not a cure for that person's disease. The medications in the second group are those that are used to treat the behavioral manifestations of dementia. We can't stress enough that medications should never be our first choice when managing behavioral issues in dementia care. There are many more effective and more appropriate measures that we can take. However, with that said, sometimes medications do become necessary. So the first question we really should ask ourselves is, how do we know when medications are necessary to treat the behavioral issues in dementia? The issue at hand is primarily to do with safety. Are the behaviors of that resident becoming so out of control and so unmanageable that they're becoming unsafe? Are they attacking other residents? Are they attempting to leave the building in the middle of the night? Things of that nature become very concerning. But again, our first line of defense should be non-medical interventions.
We moved Mom out of this one facility because it just seemed like they weren't interested enough in each individual to do things with them. It was basically medicate them and just make them be quiet and sit someplace and be still. And we just didn't like the approach that Mom was always drugged. She still had enough faculties going that she could be just a part of everything. She really didn't need to be a zombie. And so we changed her to a new facility, and they're doing so much better with her. They take her out for activities, and rather than thinking medication first, and that way she doesn't get so depressed in her room and act up and be hateful, like a lot of them do. And they take her out and do things with her, and it's just much more important to her. They don't have to use half as much medication on her now that they're taking her out to do things and getting her active.
A lot of times people will call or talk to me and just say that the patient's out of control. Well, what time of day was it? What medicines are they on currently? What happened before the behavior started? Who were they with? All those kind of things I think can be helpful in problem solving the issue, instead of just reaching for a drug and say, give it to them.
The medications in this second group are numerous. Many of these medications have been in use for over 30 or 40 years to treat conditions beyond just dementia. These medications fall into categories such as antipsychotics, antidepressants, anxiolytics or anxiety medications, as well as mood stabilizers. So let's talk for a second about why a person would take medications from this second group, those medications that are used to treat the behavioral manifestations of dementia. Here are a few of the things that these medications can help to manage: aggressiveness, agitation, restlessness, pacing or wandering, and even depression. But again, as noted earlier, these medications should be used as a last resort in managing any of these behaviors. As the name implies, antipsychotic medications are used to treat psychosis. Symptoms of psychosis are seen in various psychiatric conditions, such as schizophrenia and even some forms of depression. But of course, we also can see psychotic symptoms in persons with dementia. Psychotic symptoms include hallucinations, which refers to seeing or perhaps hearing things that aren't there. In fact, hallucinations can affect any of the senses. A person could smell or taste or feel something that's not there. But typically, it's going to affect either vision or hearing. So the person might hear voices, for example. A person might say that they saw someone coming into their room when in fact there was no one really there. The next symptom of psychosis are delusions. Delusions are false beliefs, and in dementia they typically take the form of paranoid delusions. For example, a resident believes that someone is trying to hurt them or is out to get them. It's important to stress and keep in mind, however, in dementia, that the symptoms of dementia itself can sometimes mimic what we might interpret as a delusion or a hallucination. In other words, because of the severe memory impairments associated with a progressive dementia, the person may remember things from their past, but not remember things from recent history. And it can sometimes make it appear as though the person is imagining things. So when the resident talks to you about having to go pick up their children from school, well, is that a delusion or is that a symptom of dementia? To a degree, it's arguable. Antipsychotic medications are again highly effective at managing the symptoms of psychosis, particularly the hallucinations and the delusions. The problem to be aware of with antipsychotic medications is that they are sometimes overused as a way of controlling the resident. In other words, if your resident is not wanting to stay in their room and gets up in the middle of the night, a family member may say, well, let's ask the doctor for a medication to make them stay in their room. And quite frankly, yes, an antipsychotic might have that effect because it makes them so sleepy. But what we're doing in a situation like that is really a form of chemical restraint. And that's not the role that an antipsychotic medication should play. It should specifically be used if a person displays clear psychotic symptoms. It should not be used as a way of controlling the resident. Have you ever had a resident that didn't want to leave their room? That would not engage other persons in conversation, although they did normally in the past? They sit a lot by themselves with their eyes closed, maybe just resting in a chair. They just generally seem more sad and unhappy. Well, this is where antidepressant medications can play an important role. Current antidepressant medications are very effective at treating the symptoms of depression. And while they also can carry side effects, they do not tend to be as numerous or as severe as the side effects of the antipsychotic medications. Anxiolytics or anti-anxiety medications should generally be used with caution in elder adults with dementia. While they can be effective in the short term for managing anxiety, they can have some long-term adverse effects. For example, some type of anxiety medications can develop a tolerance, where as the person takes the medication, their body becomes tolerant to it and it no longer works as well as it used to. This requires the person to take increasingly higher doses of that same medication over time. Additionally, anxiety medications in older adults can sometimes have the effect of making them feel very sleepy, lethargic, or even sedated. And again, that's not the effect we want to achieve with medications in managing dementia. So while anxiety medications can sometimes be appropriate, it is typically for short-term or perhaps PRN use. Not likely something we'd want to see our resident taking on a daily basis over many years.
Polypharmacy continues to be an issue, not only the various drugs, but the amount that are administered. Most dementia patients do well on pediatric doses instead of adult doses.
Mood stabilizers include medications such as Depakote. It's interesting to note that Depakote is traditionally used to manage seizures, but research has shown it can also be effective in managing the behavioral manifestations of dementia. You would likely see a doctor prescribe a mood stabilizer such as Depakote if a person with dementia was developing symptoms such as agitation, aggressiveness, restlessness, things of that nature.
Well, I think the most common behavior that we're concerned about, obviously, is aggressive or violent behavior. We typically see these in people that maybe have the diagnosis of frontotemporal dementia as versus to regular Alzheimer's, although we see it in both. But I'd have to say that's the number one concern.
The bottom line with these medications is they're very good at what they do. Antipsychotics are very good at treating psychosis. Antidepressants are typically very good at treating depression and so forth. The challenge is that they carry numerous side effects or adverse effects. In other words, they can benefit the resident on one hand by managing, for example, the psychotic symptoms, but at the same time, they can cause numerous side effects that really have to force you to step back and say, is it worth taking the medication? And while it's the physician's role to prescribe the medication, and we all always follow doctor's orders, you play an important role as a caregiver to communicate with the physician and communicate with the family in discussing these side effect issues. Is the resident really benefiting from taking this medication, or are the side effects outweighing those benefits?
I was used to going to the store and getting something for Mom when she needed it, and it took time to get used to the facility saying, no, we have to have that approved by the doctor. And at first you kind of balk at doing something like that, but when you understand why they're doing it, they're making sure nothing's going to interact wrong, and it was difficult for me, but I mean, I have to learn right along with the way Mom has to be treated, and it's a big learning process all the way around.
All medications have the potential to cause side effects. A side effect, also sometimes called an adverse effect, refers to any unwanted or undesirable effect from a medication. In other words, while the medication may be providing a benefit to the resident, at the very same time, it can be causing these unwanted effects. For example, while the antipsychotic medication that resident is taking is helping to manage the person's hallucinations, it's also causing the person to be sedated or lethargic. As a caregiver, you play a vital role in monitoring and managing side effects from the medications that your residents are taking. So how do we do this? How do we monitor and manage these side effects? Well, step one is to simply be aware of them, to have the knowledge that medications can cause side effects, and that the medications that are being used in managing dementia very often have more side effects and more dangerous side effects than a lot of the other medications taken in your facility. So be aware of these effects and be looking for them. The second step is to monitor. Get to know your resident. What are their typical daily routines and habits? What is their normal behavior? And watch for any changes. Is Jim sleeping more than normal? Is Mary falling asleep at the couch in the living room throughout the day? Is Jim feeling agitated or upset? When you see these changes or you see these effects, the next step is communication. Talk to other staff members in your facility. Talk to other caregivers. Talk to persons coming on from the shift following yours, and talk to the persons that worked before you came on that day. Communicate with your supervisor. And most importantly, communicate with the resident's physician. It's vitally important that the physician be made aware of any of these effects or any of these changes in the resident so that they can provide guidance to us in how to manage them. This may include changing a medication, it may include changing the dose of a medication, or it may require that the resident come to the physician's office for further evaluation. Follow your facility protocol regarding reports to the physician. It may be your responsibility, it may be a medication aide, a nurse, or your supervisor, but be sure that it does get reported. Also, don't forget to report things to the resident's family or responsible party. They want to be aware of what's happening as well. The next step is documentation. Follow your facility guidelines regarding documentation, whether it's in an end-of-shift report, in the resident's chart, or in some sort of narrative binder. It's important that we make note of the adverse effect and we make note that it was properly reported. The last step, of course, is follow-through. Whatever instructions were provided to you by the physician, be sure that they are followed through. Sometimes in the hustle and bustle of operating a facility and managing all of these different medications, it can be easy to overlook a change in a dose or a change in a new medication. Be sure to follow your facility guidelines to ensure that the proper follow-through is taken.
Yes, Mom had a very bad reaction to a medication one time, and I had been in to visit her that morning and didn't notice anything right away. Apparently the timing of the medication had something to do with it, and the staff noticed later on that Mom was acting strange and just not being herself. So they called the doctor. Instead of jumping and calling me and panicking, they called the doctor and got things taken care of, and it was just such a blessing to me to know that Mom's in good care. just that I don't have to worry 24 hours a day that something's going to happen to her because they're paying attention to what they're doing with each person and the medication.
The possible side effects from medications used in dementia care are varied and numerous. As a caregiver, you're not expected to memorize every side effect of every medication. However, it's helpful to know some of the more common or serious side effects that we might see. Sedation or lethargy. Many of the medications used in that second group, the ones that are used to help manage behavioral manifestations, can cause this sedation, lethargy, or just general tiredness. You may find residents sleeping more than normal. You may find residents slouched over in a chair, falling asleep at the dining table or falling asleep in the living room. You may find that residents are less interactive. Whereas before taking the medication, Mary was engaging, would engage in conversation, would participate in activities. After she started taking that medication, you noticed that she would withdraw. She didn't participate in activities. She didn't respond sometimes when you're speaking to her. Some of the medications that are used, particularly the older antipsychotic medications, have the potential to cause symptoms that look like Parkinson's disease. You may notice a tremor. When the resident's sitting down, you notice their hand shaking back and forth, or perhaps their arms shaking in a tremor that they can't stop. They may have a shuffling gait, where when they walk down the hall, instead of taking good normal steps, they shuffle their feet along the surface of the floor. They may become stiff or rigid. Their hands, their arms, their legs, their limbs become stiff and hard to move. And just like in Parkinson's disease, these symptoms cause tremendous potential for fall. Additionally, just like in Parkinson's disease, that tremor makes the person tired. Even though they're not wanting to do it, as they sit in that chair and shake their hand or arm back and forth for hours on end, they get tired, they get fatigued. Some medications may cause pacing. This can be a little bit confusing because we often think of pacing or wandering as a behavioral manifestation of dementia. But in fact, it could be a side effect from their medication, and we should try to work with the doctor to rule that out. A very serious potential side effect is something called orthostatic or postural hypotension. That means a drop in blood pressure when the person stands up. This causes the person to become lightheaded, possibly dizzy. In severe cases, they could even black out when they stand up. Clearly, orthostatic or postural hypotension puts a person at very high risk for falling. If you see this in a resident, the doctor may instruct you to change their medication or may simply instruct you to have them sit at the edge of the bed for a few minutes and maybe dangle their feet back and forth before they stand up. You may also see a side effect called tardive dyskinesia. This is usually displayed as either pill rolling or abnormal tongue movements. You may notice the resident thrusting their tongue in and out of their mouth as though they're chewing on something. In pill rolling, the resident rolls their fingers back and forth like they're rolling a pill between their fingers. This may be accompanied by that tremor that we talked about earlier. Tardive dyskinesia, particularly when it includes the lip smacking, can make it very difficult for the person to eat. It can be quite embarrassing when they sit down to the dinner table and they're trying to eat or drink and they're smacking their lips or they're sticking that tongue out and perhaps becoming a bit of a messy eater. Their neighbor may not be very understanding of that, and it can be quite uncomfortable for the resident. It also can put the resident at risk for swallowing trouble. They may not chew properly, they may not swallow properly, and that can put them at a very high risk for choking or aspiration. Residents taking medications used in the management of dementia may also develop something called anticholinergic effects. This is a special type of side effect that often displays as things like dry mouth, dry eyes, and constipation. This can help to be avoided not only by properly managing the medications per the doctor's instructions, but it also can be helped by ensuring proper hydration. There are also medications that can be sometimes used to reverse these anticholinergic effects. Keep in mind that these medications can also cause some lesser side effects that you see with most drugs. particularly gastrointestinal upset. The person may develop nausea, may develop upset stomach, possibly vomiting or even diarrhea. This is usually mild and subsides fairly quickly. However, in some cases it can get bad enough that it causes the person to stop eating and lose weight, which, as you know, in an older adult with dementia can be a very serious problem. So again, if you see that developing, be sure you talk with your supervisor and it's reported to the physician. Proper medication delivery is important when dealing with any medication, and this is particularly true when we talk about the psychotropic drugs often used in managing dementia. Most of these medications take quite some time to begin working. For example, many of the medications can take up to 4 weeks to reach their full effect. Missing doses of these medications can be disastrous. If doses are missed, the effect of the medication may not be achieved and the behavior may become worse, putting the resident and perhaps your other residents at risk. So here are some things you can do to ensure proper management of the person's medications. Number 1, follow the physician's order. Be sure you understand what the physician is telling you to do and follow it accurately. Ensure that medications are received from the pharmacy. If something has not been received, call the pharmacy and follow up. Be sure to order refills. As you begin to approach the end of the month and you start to run out of a medication, be sure you order that refill on time. Follow your facility and pharmacy protocol regarding when and how to order refills. Monitor the resident. If you're seeing any of those side effects or adverse effects, monitor, report, and document. Handle refusals appropriately. Residents with dementia may sometimes refuse to take their medication. While you can never force the resident to take their medication, it is your responsibility to ensure that that refusal has been reported to the resident's physician and you have followed their instructions.
She tried to hide them sometimes. They put them in her hand and she wouldn't take them. They give her little cups and she would just look at the cup and just be defiant, wouldn't want to take them. Sometimes she'd spit them out. What was really funny is you don't think they're thinking sometimes, and you'll find out that they're thinking real good that day. And we would find pills that Mom had hid. She had taken them out of her mouth out they thought they swallowed her because apparently they didn't watch her well enough, and she was taking them out of her mouth and sticking them under pillows and finding them in her sheets and things like that. And it's very easy to happen. People don't remember that sometimes their mind works, sometimes it doesn't. And so the new facility is good about that, about being more careful with the meds and watching what they do with them, staying there until they make sure they're down.
Document. Document everything. Document when a medication is given. Document if a medication is not given. Document if the resident has had any adverse or side effects. And document any communications you have with the physician, the resident's family, or other responsible persons. Side effects or adverse effects from these medications are one of our biggest concerns. But of equal concern is overuse of psychotropic medications. Because they can have that effect of calming some of these problematic behaviors, in the past they have quite often been overused. Medications should be seen as our last line of defense when other interventions have failed. They should only be used when the safety of the resident or your other residents is at risk. Never turn to medications as a first resort when managing a resident with dementia. Your aggressive attention to detail when handling the resident's medications will ensure that they achieve the fullest potential benefit from those medications and avoid side effects as much as possible. Managing medications in dementia care can be a demanding job. The work you do, the successes that you have, and your attention to detail are appreciated. It's appreciated by your supervisors, by the resident's family, by the physician, and most importantly by the resident himself. Much success to you in managing your resident's medications.